Anthony, Dr. Pirie. I think everyone just calls you Dr. Anthony, right?
Yeah, just Anthony.
Yeah. So you've been here now a little over a year?
Yep, a little over a year.
So give us the rundown. I've talked to Bird and to Jason and some of those. Like, I remember my perspective of the events of the interaction, like with Bird or with Stacy starting the gym, but so I know how it feels to me remembering when you came down and stuff like that. But
yeah.
But tell me your perspective, maybe when you first reached out and we followed up, and then you came down, and now you've been here a year. Like, tell me what you remember of that.
Yeah. So I worked in New York City for a little over a year as a chiropractor.
Okay.
Mainly
your first job out of school,
first job
right?
at a chiropractic school. Yeah, I had a preceptorship working in Long Island at Block Chiropractic, where we focused on mainly soccer and lacrosse.
Okay.
And then that shifted to me getting lucky enough to take a job in New York City. We had two offices, one in the West Village and the East Village. Predominantly lay person. It was called Warrior Chiropractic.
Sure.
Warrior as in the weekend warrior.
Gotcha.
So very general population.
But you're not a city boy.
No, not a city guy.
So how was that?
So I was ready to kind of make an exit, and I was looking for more of a team focus.
Gotcha.
So put out a couple feelers. You guys had one at Pathway Wellness, your chiropractic office.
Yeah.
So I came down here.
But you saw an ad that was in like a New York magazine, a chiropractic magazine, or an online
For you
classified?
guys, it was at New York Chiropractic College, which is now Northeast Health Sciences. They had an ad on their website for you guys.
And I will say that ad was probably close to 12 months old.
Oh, really?
Yeah, I don't know if you knew that. Like, we had been actively searching for a chiropractor. So when did you I want to say it was right
February.
So I want to say it was right around COVID-ish time. We lost the chiropractor.
Yes.
She went home, just things with COVID got a little squirrely as they did for the rest of the world, and she just felt better at home. And then we started actively searching, but we had kind of paused just because COVID was
so it was still
screwing everything
out
up,
there,
but it was just out there.
And I got lucky and I grabbed it.
Yeah.
So I applied there. I applied for you guys. I've never been to Florida.
Okay.
I saw North Florida and South Florida were the exact same.
You've learned now
and
that's not true.
I got into a plane and I flew down here and I was like, this is Georgia.
Yeah,
okay.
yes.
But no,
So we talked on the phone, right?
Yeah, we talked on the phone a couple of times, and you were like, man, you're from the city. But luckily, I grew up in the country, so we were good to go. We had like 2 conversations on the phone, and that was it.
Yeah. So what was your thoughts on that coming all the way down to Florida after? Was that like how you was that comfortable to you, or was that?
No, it was very uncomfortable.
Yeah.
I didn't know what I was getting into. We didn't have, obviously, no offers or anything like that.
Sure.
So we were like, whatever happens.
Yeah.
But I worked in Buffalo, New York. I worked in Long Island, and I went to the city, and whether this panned out or not, I was going to continue to go somewhere until I found an establishment that fit my needs, where I could practice in the manner I could practice with a team. So coming down here, I mean, we went to the bowling place.
Yeah, we went to District 850 with my family,
with
right?
Your family, and that's where we sealed the deal and everything like that. And it's been great since.
Yeah. I think for me, over the years of running in businesses and hiring people, I have found it very difficult for me to evaluate and to make an offer on the phone or by looking at a resume. And I just find that if I can meet somebody, I can get a sense.
I just
need.
You can do all the assessments and stuff like that you want on paper, but until you have a conversation with someone, it's just in the wind.
So you are you are the beginning of the rehab program here at Midtown, right? I mean, it was always something we were moving towards, but as a practicing nurse practitioner, and I was still doing chiropractic at the time, like I just didn't have the time to be at 4 different places at one time, right? So we hadn't really gotten to the rehab side of things here.
Yeah, and I would say we just now are probably getting into the position to actually like implement systems.
Yeah.
So
I mean, you've been there from the scratch, right?
Yeah. So I mean, we came in, we had the table, we had one of the gym members, and that was it.
Yeah, we just
started
got rolling. Yeah.
And now it's grown more than I could imagine organically in the last year, and very lucky for that. And now that we're implementing more and more things, it's been great.
So tell me what your as a chiropractor, maybe what your mindset is on rehab and chiropractic and physical medicine. Maybe maybe not a full 30,000 foot view, but maybe a 15,000 foot view. Like, how do you view your role as it is with our population that you're treating, and how do you see that?
I believe that my role and like my opinion on it is being as specific as possible. If you we're in Florida, if you play baseball, your programming needs to be tailored to playing baseball. If you want to be a CrossFitter and you have just leg pain, like your program should be tailored towards that. So I believe that here, creating a system where we go through a good initial assessment, opening, stuff like that, and then you have this wonderful personal trainer that can do the strength and conditioning aspect of it.
Sure.
And then have somebody else from a communication standpoint doing nutrition, like you with your nurse practitioner. It's just filling all those small gaps to achieve like the best outcome possible for any patient that walks in the door.
So maybe speak to that same question, but from your role in that, like, how do you see your application of chiropractic? Are you...
Yeah, I went to chiropractic for a reason, right? I believe in it. I like chiropractic. I believe adjusting patients, creating...
You're a manual, hands-on, right?
Yeah, so I would describe myself as a manual therapist with implementing a lot of movement. I try to... It's hard, right? In chiropractic world, we have a lot of different systems. You have McKenzie, you have Neurodynamic Solutions, Mulligan, ART, Graston. So it's very hard to, like, what do I want to do with this patient? And like that's like probably the biggest thing that I've learned to struggle with. But
yeah, I think chiropractic as a modality, right, different than maybe my role in nurse practitioner and allopathic I've seen, is chiropractic is, at least when I went to school, and maybe you can speak to it since then, but it was a little bit void of specific treatment paradigms for a specific thing. Like, I imagine, and to varying degrees, like you walk into a hospital with, the coronary artery issue, or you've got a stroke, or there are systems and there are algorithms and there are systems in place, right? Yeah. You walk into a chiropractor's office with a herniated disc, good luck, right? You better hope that the doc on the other side, there is no specific treatment paradigm which all chiropractors to a majority agree upon, right? Yeah,
I would say that's the hardest part about it. When you go through school, you learn the same thing. Like, you're just like, do this. Eventually, you might get lucky.
Right.
So we lost that system. I was lucky enough where I went to physical therapy assistant school in Buffalo, where you learn, if you're doing an ACL, it's like a 36-week protocol.
Right.
You get that physician protocol, and week by week, if you're not at week 4 of this range of motion, this passive range of motion active, you don't progress.
Right. And that's void, I would say, in chiropractic, right?
I think so.
So we have had to develop our own systems, right?
Correct.
And I think one of the things that I like about you as a physician is your attention to detail, your knowledge of anatomy, physiology, and your desire to have specific, repeatable outcomes within a treatment protocol, right?
Yeah.
Which I think is void in a lot of chiropractic offices.
I think it's when compared to when you went to school to when I went to school, like the big difference now is like, if you go to the right...
It's not that long. Come on now.
Not that long, but we have like, I don't know if you guys did like ossuentries and like NDIs and stuff like that.
That was probably like just coming in, right? Yeah, just getting
and
implemented.
Now that stuff is day one walking into an office.
Oh, yeah.
What's my baseline, and like what outcomes can I actually achieve with this patient in 4 to 6 weeks? And that's the beauty of working with you, is being able to push those guidelines, especially with like regenerative medicine. I think in integrating that into rehab and musculoskeletal conditions, it's been every day it's something new.
Yeah.
And it's impossible to keep up with, but you go home and you read something different every single day now.
Yeah. I think you've done a good job being able to integrate multiple modalities from different paradigms. Like, you've become well versed with the peptides, and we've probably, I would imagine, and I don't think I'm incorrect in saying this, I would probably say that maybe top 1% in knowledge in peptides in the chiropractic world. Like, I don't know. I can't think of anybody.
Chiropractic aspect.
Chiropractic, right, yeah. But I wouldn't expect you to know more than an MD in surgery, right?
Right.
And I wouldn't expect the surgeon to know anything about chiropractic. So, but I think as far as a modality that is specifically applied and well applied to a chiropractic patient, right? I mean, I think you have a knowledge.
Aspect of
yeah,
it,
I think
sure.
you have a wide breadth of knowledge in a lot of areas, and your willingness to learn and study is nice to see, right? Your desire to learn more and integrate those into your practice, I think, are good. What has been the most surprising thing or different thing from school to your first jobs to this job, and just in patient base and what you thought medicine would look like or chiropractic would look like?
Every single patient is different. I mean,
yeah.
Every single day I still get surprised. Pain is interesting.
Sure.
And, you know, when I was going through school, you learn opioid theory, gait pain, mind body, you know, these just words.
Right.
And then you see someone come in your door, 10 out of 10 acute pain, you're like, what do I do?
Right, yeah.
And, you know, it's like, what system do I go with?
Sure.
Like that's the hardest part, in my opinion, as chiropractic. Like you were saying earlier, is you have all these subdivisions of categories, but you don't know how to treat the actual costs. And
yeah.
And I remember you teaching me McKenzie.
Right.
Someone coming in with low back pain, all of a sudden they do these 10 random extensions, and they're 2 out of 10 pain.
Yeah.
And
I remember when the first herniated disc in a neck came in my office, and I was like, oh shit, I don't know what to do.
Yeah.
Right? I had to call my preceptor on the phone in the back office, and I
Yeah.
was like, oh, hey doc, I need some help here. What's going on, right? Because we were taught this theoretical, and I think in allopathic medicine there's a lot of systems, right? You're a new doc and you go in a hospital, there's the older docs, right? You have an attending physician, then you work your way up and you may be an attending, and then you might get your way into private practice, but you're the new doc, and then you work your way up in that, right? We don't really have that in chiropractic, right? You were probably thrown to the wolves.
Yeah, I did a lot of
city, right?
I did a lot of pediatric pregnancy.
Yeah.
And I was like, I don't know. I didn't learn this in school. I took an 8-week course in it.
Sure.
But that's why I love this. That's why I took the job, right? Like you had Pathway Wellness, your chiropractic office, and then you took me here. And it was just an open room where it's like, what's going to happen here? Like, it was like scribbled on paper, like a lot of your stuff is.
Yeah, right. We had no idea. I was like, let's do this.
And it's just, now it's like a lab.
Right.
And it's figuring out, like, you know, we're working with different things every single day, and being able to cover every single aspect of it is you cannot get any better from like a medical standpoint.
Right.
Having somebody come in post ACL surgery, being able to run a peptide, based with musculoskeletal needs, do the blood work, identify the actual compensatory issues, and then work with a trainer to better it. Where do you go wrong?
Yeah.
And it's.
So, what do you think your sweet spot? Chiropractically speaking, patient speaking, like what do you bring to the table that's different than other chiropractors? Like if you had to sell yourself, what do you think?
Oh God, that's a hard
one for you, probably specifically.
It's hard to dive into myself as a whole. I have an obsession with shoulders.
Yeah,
I like shoulder injuries.
More broadly speaking, tell me what makes you different than say going to a chiropractor down the street.
I care.
No, that's true, right? We've talked about this in the office a lot.
Yeah, like we genuinely care about the patient.
Like how many times do you come back and like, hey, I got this patient, I tried X, Y, and Z. What does A, B, and C look like? How do I try this? Yeah. I don't think that's like you may take that for granted, but I don't think that's the standard of care. Like
no, like we will find the issue. And like that's like if not, it'll eat away at you. But I think I have a good knowledge base to be able to look at every component of it, right? We sit down and we have an actual initial assessment for 45 minutes to an hour where you sit down and go through you let the patient speak and you actually listen to them. Like that's the difference, right? You actually take it all in, and then we have the ability to look at it from a biological standpoint, whether we need to just calm tissue down to restore range of motion, to implicating specific rehab, and like the whole 9 yards, I guess.
I think when I tell people like what sets Anthony apart is I think your ability to genuinely care about a patient's outcome when they're sitting there in front of you. I don't think you should take that for granted. I think you have a strong anatomical knowledge that a lot of physicians in general, chiropractors in general, don't necessarily have. I think your desire to truly know what you're doing is the right thing and is helping the patient is paramount. And I think like your desire to do what is best for the patient, whether it includes you or it includes somebody else, it's what's best for the patient is paramount, right?
Yeah, I mean, we'll always refer out and stuff like that. I mean,
Right.
Yeah,
or even within here, like, I think maybe you'd be better off using your money, like, let me just teach the personal trainer how to guide you in a rehab program because you don't need the acute care, or the opposite may be true. Like, I know you're with the PT, but honestly, you're not going to get anywhere. We need to take it back because you're in the acute phase, and probably should be on my table.
This is my first time going from a cash-based practice to an insurance-based practice.
Sure. It's very
learning
different.
the realm of that and how different it is and what we can do in that realm. But yes, no, I would agree with that. I think just we want everyone to get better,
right,
and achieve an outcome.
Yeah,
and I think we do a good job at figuring out the baselines and the measurable units that we can use to achieve said outcomes.
So, taking a little bit of a left turn, tell us a little bit about your background growing up. I think I know, or other people know you competed, or your history in sport was in hockey and powerlifting, right?
I grew up
way north.
Ogdensburg, New York, 2.5 hours northeast Syracuse. So on the 2 minutes from Canada. So
you can't
if you don't
get
play
further
hockey,
north.
You're doing something wrong.
Yeah, it's all hockey, right?
It's all hockey. We got decent soccer and football, but different seasons. Like our soccer season is the same as football.
Oh, interesting.
Because it's not as competitive, right? Down here, I learned that it's kind of flip flopped.
Gotcha.
Yeah, I played hockey for a long time. I'm too short to play juniors, so I had to figure out something else to do. So I went and played rugby in college.
Oh, did you really?
Yep. So I played rugby in college.
Where'd you go to undergrad?
I went to undergrad at SUNY Canton, and then I actually played rugby at SUNY Potsdam.
Okay.
So it was like a parenting school about 20 miles away. And then I moved to Buffalo, and then that's when I fell in love with lifting. I never did it before.
Oh, really?
No, never. Like,
Not even for sports, or just a little bit here and
there?
there?
We had a bench press in our living room, but, I mean, it was more like my brother and my dad getting us into it, but it was...
That's it, yeah?
That's really it. Moved to Buffalo, was lifting at a gym, and someone was like, go compete.
Really?
And, yeah, it was so... I was like 165, squatting 520, and they were like, hey, why don't you go compete? And there was one next weekend, so I dove in.
You just had a desire to push more weight on your own then? You weren't doing it for competition?
It was just by myself.
Really?
Yeah, I just fell in love with it, and it was fun. It was kind of like an intrinsic goal that you could set, and it was measured weekly. You either did it correctly or you didn't.
Yeah.
You didn't. And I was going through physical therapy assistant school at that time, so it was being able to attach anatomy and stuff to it, and then that's when that kind of started twisting a little bit.
Yeah.
Getting injuries and learning, hey, I want to go do this now. But yeah, I competed lifting for about 8 years.
Oh, wow. I didn't know it was that long.
Yep. And then I got into multi-ply lifting, which is geared lifting. And I took a bad squat where the bar rolled off my shoulder and it went with it. So,
oh, wow.
Yeah. So luckily we have safety squat bars now, so I can squat with those.
Is that why your shoulder specificity or love for shoulder comes from?
That's why I like shoulder so much. I went to PT and a chiro for about 6 months, and it got 0 results.
Really?
Yep. It was do this band, do this, put some ultrasound on it.
Do you think they just didn't understand your injury and your perspective as a lifter? Didn't have an anatomical...
Just paying the bills.
Just paying the bills.
Just paying the bills. I think that's what it was. I think also, though, if you go all the way up north, I think healthcare is a little bit outdated. It's not as caught up with, that was one thing I learned when I went to New York City, was everyone is kind of pushing the envelope of care.
In the city, you say?
Yeah, in the city.
Different than where you grew up?
Yes. It's still ultrasound and E-stim, every single injury, no matter what.
Yeah.
So, learned a little bit of rehab, started diving into different podcasts and YouTube and stuff like that, and I was like, let's go to chiropractic school. So I went to chiropractic.
So even though you had not a great experience with the chiropractor and physical therapist, you still went into physical medicine?
Yeah, chiropractic to me...
As like a way to say, like, I can do this better, or...
I believe that chiropractic should be the front line of all spinal conditions.
Yeah. Musculoskeletal or spinal?
Musculoskeletal, I should say. I believe that prior to having this knowledge, when I would watch certain videos and stuff like that, the entrepreneurial aspect of it is obviously a thing, right? Up north, I saw only PTs did like inpatient kind of stuff.
Right.
So then I learned obviously that was different. But I believe that chiropractors are like the gold standards for musculoskeletal conditions. Going through school, the anatomy, the neurology, and everyone wanted to learn more.
Yeah.
Like, like we had groups like R2P and Motion Palpation Institute and stuff like that.
Yeah, we dive heavy into palpation and biomechanics. And
very heavy.
Now, was your school more musculoskeletal based?
Yes.
Only musculoskeletal? Okay.
Not only. We had probably, I don't know, 2 classes in philosophy. Not too bad, though, compared to other schools, right? Like,
so Palmer was, I tell
deep.
people Palmer was 50-50, right? I think we're diving a little bit into the weeds of chiropractic, but you have schools like Life, Sherman up in South Carolina, and they are what we call the straight philosophical chiropractic, right? Chiropractic is the modality of all healthcare. Palmer, I would say, is in the middle, right? We had, I would say, from the top down. It wasn't just student groups. It was our faculty were very much split. We had Dr. Siemens and Liebenson types, and then we had the philosophy types, and we had classes from both of them. And there was really no love lost between them, or it wasn't necessarily like this kumbaya atmosphere. But for me, not understanding any of that before I went to chiropractic school, it was good. Like, I got to see both camps and be like, this one makes more sense.
Though. Like, you get to see, like, hey, like, those guys who have a subluxation-based practice, if they surround themselves with a good massage therapist, a good physical therapist, their outcomes are going to be the same.
Yes.
Which is amazing. Like, that's what shows me that, like, every single person, as long as you have a team aspect of it, you're good to go. That's kind of where I saw it firsthand. Is that why? That's where I saw it firsthand. As I did when I did my one preceptorship, one of the guys, there were 2 brothers. One of the guy was more straight, and the other one was more mixed, per se, however you want to say it. But they both got the same goals, and that's because the guy who was just, hey, like, I'm only adjusting, he had a phenomenal massage therapist that he had passed the person to, and then a nutritionist, and then they were covering every single aspect of it. And he probably was doing the best at looking at the spine. So, I mean, it just goes to
those
show.
straight, quote-unquote, chiropractors are sometimes not the best adjusters.
Yeah.
Right? I think one of the things I noticed at Palmer is no matter which camp you fell into, you had to hold your water because you were going to get grilled by someone from the musculoskeletal side.
Yeah.
Or if you were on the musculoskeletal side, you had to know what you were talking about because you were going to get grilled from someone on the straight side, right? So you couldn't just fall into this dogmatic view of how whichever side you approached it, you had to understand it and be able to articulate it. And so,
if you go a little bit too evidence-based, I think you miss the marker on some things, and if you go the other way, you miss the marker on other things.
Yeah.
That's life, though.
So, tell me, let's fast forward 5 years. What do you see? What do you want to see? What do you want to shape? What do you want to influence for your role here and for how it looks? Like, what do you think?
That's funny. We were just talking about 5-year plans over this weekend.
Yeah.
So, I mean, what I would like to see is just continuing to push that envelope of, like, gold standard care. Like, I want any person to be able to walk in here, or even in being in Tallahassee as a whole, and be like, I have a unique injury. It's not going anywhere. I've tried XYZ. Like, where do I go?
Right.
You go to Midtown. Like, I run this place like a lab where we see multiple different type of injuries, and there's going to be someone, regardless if it's myself, you, or Montana, or Bird, that has the knowledge base to aid in taking that injury and fast forwarding it. So seeing another therapist here treating hands-on, I think we're pushing into that direction. Integrating the breath work, the plunging and stuff like that. It's just continuing to push that envelope forward.
Sure. Cool. Awesome.
Yep.
It's been fun.
Yeah, I appreciate it.
Any questions for me?
I got nothing. I could try to think of some things, but no, that's about it. Where do you see it in 5 years?
That's a good question. I think when I think about what role I brought you in to fill, I would like to see, I think of my role as helping you grow as a chiropractor, helping you grow as maybe the inevitable reality of being the business side of chiropractic. Yes. You have to be well-versed in that. But I think I would like to see you put your stamp on Midtown. I don't want you, I've often said this about other therapists and other people I don't want you to be a version of me. I want you to be I want you to be able, a patient to be able to integrate with you and me, but I want you to be able to different and have different skills than me and different skill sets. But I think I want it to be very much Anthony's stamp is undeniable on this. And I think chiropractic has a tendency to eat their own. Maybe every profession, I don't know. I'm not going to speak about it.
I would agree.
But as an individual, I don't want to be that person, right? I want to see you grow and succeed and be able to fulfill those educational and patient care goals in a sense, though, that you are happy and you have a life. I think a lot of new chiropractors, they step into as a role where they just get abused and they're working 70, 80, 90 hours a week.
I worked Monday through Friday, 8 to 8.
Right.
Split shifts.
It's terrible, right? And it just burns you out, man.
Yeah,
I would rather see you in 5 years be a better chiropractor, be a better person, have the ability to investigate and make right turns and left turns in your care, and ultimately end up at a better area, both personally, professionally, and financially.
Where do you see yourself as far as you think healthcare is pushing more into with the regenerative side of things?
I think that will be a big part of it. Like, I just started training in stem cell therapy. Yeah. It's still a little bit murky in the water, right? It's a little unsure if the FDA is really allowing it or not allowing it, and it's hard to get guarantees in that world, but it's pretty damn exciting. Things like PRP and
in the last decade,
regen.
PRP's gotten better and better and more specific. So
and then we've also learned that, wow, PRP was this really cool thing that was off in the distant future, and now it is sort of like, oh, that's old hat. Like, are you doing stem cells?
Right.
Are you doing these things? And so we've talked about it. So it's good. It's good to have a partner who is willing to push the educational envelope as well. Like we've said,
that's why I took the job. When I flew down here, the first thing I saw on your desk was two studies.
Oh, really?
And I was like, oh, this guy gives a shit.
Yeah.
He's still educating himself. And it was like, you weren't there actually because your daughter had a CrossFit competition.
Oh, that's right. That was a Festivus,
I'm looking at his desk and I see like 2 studies laid out with like things highlighted and stuff.
Oh, interesting.
And I was like, oh, he still learns. He still cares.
Well, it's tough, right?
That doesn't happen anymore, though.
It's tough because as a practicing physician, you get stuck in the business side of it. And you get stuck in the patient care, and then when you come out of school, you're ripe with all the information, but you don't have any of the experience. And then when you've been practicing for a while, you have all the experience, but you start to lose touch with the information. So it's hard to integrate those two.
It's very difficult. And like we talked about 1,000 times, there's 1,000 things to learn out there. And it's like, what do I want to master? Do we be a jack of all trades or a master of none? And it's difficult.
Yeah.
Thank you.
Awesome. Cool. It's been fun, man.